I think we are ready to start now. Welcome, everyone. I'm so thrilled that we are here on this hot July day together. And in Delaware, in particular, it's a pretty momentous day. Our governor, I know, has removed the emergency order. But we all know full well when COVID shined a light on the challenges, not only with physical and emotional health, that many of us have been working for years, and particularly those of you around this table who I consider friends, colleagues, and experts in behavioral health. Many of you have joined us, my office, working with the Behavioral Health Consortium as we've laid out a roadmap, not only for children, but adults suffering with mental health and substance use disorders, the twindemic of the opioid epidemic, with our pandemic. But we know that today, as we come together in this room, it is up to us to address those challenges. We know 3 in 4 children have anxiety or depression at some point. 1 in 2 a behavioral health challenge. That's significant. That touches me as a nurse and an educator and a mom. It's real and it's palpable. And I am so thrilled to be here with cabinet secretaries and leaders in the Colonial School District, the Department of Ed, the team players who put this together. I don't have time to thank each of you in my office. You know who you are. Thank you, because we're on a mission. We have an hour and a half to share, but I am thrilled to my right to be joined by some of America's best selfless public servants. Patrick and Amy Kennedy, thank you for coming with the Kennedy Forum. We are going to get busy. Thank you. We are going to get busy today working on resources, strategies, beginning of more plans. I have had the incredible opportunity to work with Patrick on a number of other initiatives and am just delighted that they took the time to be here. And I don't have time for their resume, but if you get a chance, look up on Wikipedia. You'll love their story and their background. And thank you for being here. Really so important. And so as I thanked everyone, I really am genuinely sincere about looking at collaborative possibilities. They're going to listen today, hear some of the things we're doing in Delaware, and think about those possibilities, not only with the Kennedy Foundation, but with Amy's leadership and her work with the JED Foundation. Too many young adults have attempted suicide. Too many young adults have taken their own lives at their own hands, or taking a friend's life with a gun, with other trauma and ACEs, and we have experts here today who've been working in that and with our schools. And finally, before I turn this over as we do lay out this roadmap, I want to embarrass my colleagues from the legislature who came, and I'm going to ask them to stand, and I'm going to recognize Senators Poore, Senator McBride, Senator Pinckney, and Representative Kendra Johnson, who are here, and thank them.
Dave Pacola.
Okay, there's Senator. And my Senate pro tempore, who's in the back. Please tell me you did not ride your bike today here. But we want to thank him for his work and his leadership in education. Having said that, we have a number of folks streaming in who could not be here today, who have worked on bills that we all know, whether it's House Bill 100 or access to services in our state around children. We say thank you to those streaming in and listening today. So again, it is compelling. It is upon us to make the changes that we need to address family and children's mental health. If you saw Time magazine, the summary of the cover is what we have stated in Delaware for the past several years with the consortium. For 4 years, we saw our incredible tennis player, Naomi, and what did she say this week on Time magazine? It is okay not to be okay. So today, we're going to take that journey on an hour and a half and accomplish a lot. And it's my honor at this time to keep us on time. I'm going to turn this over to our good friend and Delaware's leader in Secretary of Education, our awesome Secretary Bunning.
Thank you and good afternoon. I would like to continue with these words of gratitude to Jeff Menzer for allowing us to use his school today, and Principal Lisa Brewington, Deputy Principal Jim Zimmerman, and the entire Colonial School District, the team here for hosting us today, and more importantly, for the work that they have been doing in leading to support our students in this area that we're going to be investigating. And I thank you, Lieutenant Governor, for being a tireless advocate for the health and well-being of our students, including championing this work before social and emotional learning and mental health became an issue. And we've now made everyone aware of the importance of it. Our educators, our school counselors, and our school staff members know firsthand how important this work is. They see what's happening in our communities on a daily basis and how it affects our students. They know that our children must have their emotional and social mental health needs met if they're going to be able to effectively focus on the learning that we are here to make sure that they have before they leave us. That academic content can only become part of their lives when other things are under control. So every person who works in our schools can tell you a story. Some of them can tell you many stories, and these stories are sad. They're heartwarming stories and heart-wrenching stories. So ask an educator about what's been happening in their classrooms. They can tell you about a child who desperately needs the supports, but these, unfortunately, are the norm now, not the exception as they once seemed to be. So I'm truly grateful for the support of public and private partners who recognize our students' challenges, and they are willing to collaborate with us, to partner with us, to recognize our students' challenges, and to collaborate with us, both to provide critically needed supports and to raise awareness so that these needs remain on the forefront of our policies, our programming, and our resource allocation. On their and our staff members' behalf, I want to thank you for being involved in this. A big-hearted appreciation from all of us, and I want us to work together believing that the possibilities that you mentioned can become probabilities if we work together. We have that opportunity. Thank you.
Yay, awesome. Thank you. We appreciate that. Yeah. And we're just going to stick to the agenda. You all are educators. I'm going to let you self-lead yourselves today. Dr. Jeffrey Menzer, we'll turn to you, our superintendent.
I'm going to be really brief. Welcome to Colonial School District, William Penn High School and the Innovation Center. We're honored to be hosting this great conversation and much needed conversation in the state of Delaware and across the country. I am going to, I said, be brief. I'm going to defer to Dr. Cooper, our director of our Wellness and Health Division, so that he can kick off and talk a little bit about some of the things that are going on in Colonial, and also you'll hear more about what's going on across the state. So, Dr. Cooper, the floor is yours.
Thank you, Dr. Menzer. I want to start off by thanking you, my boss, for putting us in the position to do this. Why not? Hey, that's my boss. And, of course, our Board of Education, who's essentially supported the work that we've done in Colonial around this area. I also have some of my team members here, Dr. Sherry Woodall, our supervisor in the division, and my colleague Jim Colleges, director of schools, and my colleague John Barr, our security specialist. Part of what I'm going to be talking about this morning, I've talked to some folks as they've come in. We have the same responsibilities every public school in the country. So there's nothing special about what our challenge is. What I'm going to talk a little about this morning is the way that we've gone about it, share some of our ideas, and also look forward to hear from some of you. Today's also a cool day because it's also the launch of the new name for our division. 2 years ago in 2019, we created this Division of Behavioral Health. It's become so much more than that. So we've recently renamed, as of yesterday morning, the Division of Health and Wellness. So you'll see a handout here that describes that a little bit when you get a chance before you leave here today, if you take a look at that. But really there's two reasons, there's two parts to the name. The one part is, in my mind, it's a description of what we do, but it's also meant to be aspirational. So it's also meant to be a challenge. So we'll start with the descriptive part, and then I'll talk a little bit about what the challenge that this presents to us. So it describes what we believe, and what you're going to hear with our speakers today, the integration of medical health, health systems, with education, with social emotional learning, and social services. And that integration is really what we're all about here today. It also is aspirational in that it sets a standard for us. What do we want our kids to experience in school? We want our students and our staff to have that feeling of wellness. And not the kind of wellness where you're just walking around smiling all the time, but the kind of wellness where you feel that you belong. You feel that you're part of something bigger than yourself, and you feel that you're part of a community. A couple of the things that we're doing right now in Colonial, we've done for the last couple years, you'll hear about more today with our friends from Life Health Center and from Christiana Care. but we've really worked across the state and within the district to expand our students' access to school-based wellness centers. We have a wellness center at the high school. It's been here for many years. We have elementary wellness centers that are run with our partners in Life Health Center. And we're also hoping to expand into more elementary schools and possibly move into our middle schools and high schools. And that wellness center model, which you'll hear a little bit about with our friends later today, is really that integrative model. We've also increased our support for students in crisis, and I know that's a particular interest of our guests today. A number of things that we've done in the past year is we've increased our services responding in real time to students who are doing searches, troubling searches, either on their phones or on computer devices. And my colleague John Barr, who's joined us today, we've actually done, other districts have done it, but we did it in earnest this January, responding real time to students doing troubling searches. And sometimes it's during the day, and sometimes it's 10 o'clock at night on a Friday. But we developed a system pretty quickly where we were able to get the information we needed. We were able to contact school principals. We were able to have those principals do a personal call to families. And when we started this, we kind of thought that families might be saying, like, why are you bothering me at 10 o'clock? That's not what we experienced. We experienced as families being very grateful. Sometimes it was a false alarms, other times it wasn't. More times than not, this translated into a student getting a higher level of care, so we're really excited about that. We're participating in the 988 rollout, which is something that I think folks know. Not everybody here probably knows that, but 911 is going to add a component of 988, which is a direct contact for mental health services. We're participating in that. We started having, for the first time, a full-time bilingual therapist at William Penn in the last year and a half. And that's helped with our crisis, too, because sometimes when we've had these crises, there's a language barrier. And we can't always get to a language line or the friendly Spanish teacher who's available. So we've had a bilingual mental health therapist here. We've also started in the past year increasing our support for LGBTQIA+ students at William Penn, and something that we're really committed to as well in all areas, and not just the mental health and services, but again, part of that community and making sure that all of our students feel welcome and feel part of that community and don't have to ask about how to navigate certain things. We want our students to know what we stand for, what our values are, and how they can get the support that they need if they need them. Other thing going into next year, and we have colleagues here from Department of Education who are probably going to talk about this as well, but we're increasing our focus on Tier 1 supports for all students in the SEL area. So we're starting, for the first time, to do some universal screening for social emotional needs. One of the things we found when we did an informal research study 2 years ago, just on the back of the napkin, we looked at our students who were presenting with some type of concerns about self-harm or things like that, and then we mapped that across other databases we had. How many of these students were appearing somewhere else? How many of them maybe had some academic challenges or other behavioral challenges? And what we found is that 50% of our students who were coming forward with some concerns, we didn't know it until they made a troubling search or they asked for help. So that told us that we have students with unmet needs. So part of that universal screening process is going to help us reach those students. And finally, I wanted to talk about the challenge. So what we're doing, but what's the challenge? The challenge is, and I'm actually going to read this because I stole this from a presentation I went to several years ago that a school district used in the Northeast following some tragic circumstances at their school, that they resolved to ensure that the mental and physical health of our students and their caregivers are addressed with the same level of attention and concern as we give to their academic and cognitive achievement. And that sentence to me encapsulates what we're about here today. And so finally, I'll just say that what we need to do, what we're compelled to do, what our division is trying to do is, again, when you get a chance, the partners that we have, many of whom are here today, is to draw on that power of we. You'll see the power of we as symbolic of what we do here in Colonial, and we really need the strength of our partners across divisions, across agencies, public, private, government, and so on. So with that said, I'm going to turn the floor over to my colleagues at Christiana Care to talk a little bit about the Wellness Center that they help us run here at Colonial.
Awesome. Thank you so much for the opportunity. We're very thankful for the partnership that we have with Colonial. I did prepare a statement just to keep ourselves on track for time, so if you see me looking down, that's why. Christiana Care has been providing health services to Delaware students in the school-based health centers for the past 27 years, beginning coincidentally with the William Penn Center, which we're here today, back in 1994. All students in schools with wellness centers, and we currently have 18 high schools and 2 elementary schools, can access services, including mental health counseling sessions, medical services, and nutrition counseling. In accordance with Delaware law, students aged 14 and over can self-consent for mental health services. Counseling services can be provided in person or through telehealth, which increases our outreach efforts, which were instrumental in our ability to continue to provide assistance to families during the COVID pandemic. Our standard of care is to screen all students annually for risk behaviors, including mental health concerns and substance use. We use 2 evidence-based screening tools, which are then individually reviewed. Students with concerns are scheduled for further evaluation with our providers. Our mental health providers have completed training that emphasizes a trauma-informed approach. Students indicating concerns for depression are further screened for suicide risk. We develop a collaboration with community-based substance use programs to facilitate in-school assessments and treatment. This partnership reduced some of our barriers and associated risks with students being able to access these services outside of school. Additionally, our school-based health centers and Christiana Care's Department of Behavioral Health established a fast-track path to connect students to psychologists specializing in pediatric mental health services. Critical services, such as medication initiation and management, can occur in a timely manner. Our wellness centers clinicians also focus on education and prevention. For example, we developed a curriculum as an alternative to discipline measures for students with substance use infractions. In conclusion, Christiana Care, the school-based health centers program, remains committed to providing critical health services to Delaware students in a supportive and familiar environment to promote learning, address risk behaviors, and promote healthy lifestyle choices. So we're, again, very excited to be here today to speak about the services and our behavioral health outreach resources and innovations. So thank you very much.
Thank you.
That was it for you.
Great.
You're going to be quiet today.
We'd like to invite everybody who would, after this is concluded, would like to come down and tour our Wellness Center. We will definitely have people be able to point you in the correct direction. And if you'd like to see an example of a Wellness Center that is right in this school, we'd love to show you around and explain a little bit more about what we do.
We're gonna do more. And we also have a handout as well to provide a little bit more information about our wellness centers and give some information about our locations and the further services that we provide. Great.
Well, we thank you. Glenda
Thank
will
you.
take you up on that with the PNP.
In fact, one more
Yes,
thing.
go ahead,
I also-
yes.
I neglected to acknowledge, we have a William Penn graduate, Jimmy Zimmerman, in the audience today, who has also made use of some of the services we've had the chance to talk about today, and I wanted to acknowledge him and thank him for
Great.
coming,
he'll
representing
be-
the students.
Good testament. Thank you for that. These are good openings. Thank you so much. And keeping on time, right? Sitting next to one of my former teachers, should I say that, secretary? Keep me on time. We are going to the Life Health Center now to hear. I know they could talk for hours, but we have a limited time, gentlemen. They do so many incredible things. Mr. Forrest Watson, the third, I have to give that title, and Nora Wood Coleman. Thank you to both of you.
Well, thank you, everyone, for coming today. I'm going to talk maybe 3, 4 minutes about what we do, how we do it, and why it's important. Of course, you know why it's important. But before I do that, we have something internally that we do, and for our therapists, and actually for all our healers in our organization. It's called Project Discovery. Project Discovery is the process of becoming authentic within yourself to become a better relationship person. And so we have our technical competency, which we do, and Norwood Coleman leads our training and technical competency programs, where we deal with the trauma-informed, the depression, and all of the things that we need to be competent in what we do. But beyond that, we understand that the relationship is the most dynamic thing that impacts healing. It is the most dynamic thing that impacts healing. And without a positive relationship, quality relationship, healing doesn't really occur. And individuals in that relationships don't really perform well. You can throw a lot of information at them, but if the relationship is damaged and not of a quality, it achieves very little. It's sort of like a diminishing return. So Project Discovery is what we do, and everybody does it. It doesn't matter whether you're a clinician. an administrator, a receptionist, a biller, everyone goes through it in the presence of one another. And what that does is that promotes the kind of internal discovery that you do in the presence of people so that you can become more aware of what it is to be a human being and allow other people to take that same discovery. I'm sitting here today because I'm going to reflect on that just a little bit. This is my first time in with a lot of people in almost 2 years. I'm aware, as a result of Project Discovery, I'm aware of what I'm feeling at this point. And there's anxiety, there's hesitancy. I had some hesitancy, I got my mask here, and I had to take it out. But and put it down. But one of the things that made me realize is that this is the journey that our students take. We deal with K through 5. This is the journey that our students take. And sometimes we need to go back into our history of being a child so that we could be more effective with our children. And that's what Project Discovery is all about. So I want to share that with you because in the middle of being nervous and with anxiety, I had to share that so that I can be more human in my story to you. And that's the kind of relationship we share with our children so that we can give them the permission to be human as well. That they can feel what it's like and then work through the challenges of becoming more human, taking those conflicts or those resistance and bringing value out, that going deeper into themselves to recognize the strength that they have. And so I'm going to let Mr. Norwood speak a little bit about the technical. Well, before I do that, I'll tell you a little bit about what we do. We believe that wellness and health is so important as we intersect education. We're fortunate to have the Colonial District as a partnership, and they're forward thinking. Years ago when they came to us about this concept, we were already, as an organization, understanding that there are multi-pillars of, or what we call over here in healthcare, determinants of health. Social determinants of health, you've heard, behavior and mental determinants of health, and then our physical determinants of health. And we, as an organization, take all those determinants and put them in this whole delivery. And we know what it's like when we address families, individuals and families that way. Because first off, we're the village. You know, we take a village to raise a child, but we're the villagers. So we have to understand that the villagers are healthy. You know, how many of you have flown? I've flown quite a bit over here in the last 40 years of my life. And the first thing they say when that mask falls down, they say, well, you who have small children or somebody who's incapacitated or needs struggles, the first thing you need to do is put the mask on yourself. Because then you can help someone else. Because without that, it's dangerous to try to help somebody when you're suffering and dying and yourself. In fact, both of you can die. So the concept of that, of our organization is, let's move into the reality of understanding relationships with ourselves. So that's what we do, and we do it in, you know, we have all the traditional services that you are accustomed to hearing. Physical health, we do all of that. Social health, we do. Behavior and mental health. But it's important for you to understand the journey that the Life Health Center members undergo when they come to work with Life Health. They go through this journey, and we do it every month. And so that's an important concept. One more important concept is that we have what we call Life Health Center core values. There are 10 core values that we operate by that guide every interaction with everyone that comes into our organization. The first of which is cultivating quality relationships. Without it, I said relationships is the most important thing. No matter what you do, whoever you're with, what you're doing, relationships. And I don't want to be preachy, but I think it's important to do this. Integrity. Integrity to us is so important because there's so many other issues that build on and challenge your integrity. So integrity is being true to yourself. Finding that place where that truth is, where you have red rock. And then active listening. Personal discovery, growth, empathy, love, healing, and safety. Respect, service, and competence. Togetherness, unity, and extended self. And that's important because that gives us the village concept. That gives us the village concept. So that's how we operate. And everyone that comes in our organization is indoctrinated, so to speak, into this culture. And so we know that we can't do this without the villagers that are our educational friends. Because even though we are health, but this is an intersection where health and education intersect. One last thing for me is I'm going to share a couple stories. Stories are very powerful. And what we try to do with each and every one of our children is to give them the expression to talk about their story and to value their story. And at the time they value their story in the presence of a human being, they know they're valuable. And then the sky is the limit. The sky is the limit. The sky is the limit for them. So, a couple stories, one of which is just in no particular order. When I first got to college, it took me years to get there. This one particular school, it's an Ivy League school, I tried 3 times to get there. On the third time, I was now in the Ivy League school. Third time, I was there. And I came from very poor backgrounds, very poor background. So poor, you've heard the story. And so I didn't realize that I was moving in class as well as academics. I didn't realize I was moving in class. So I'm in a course, I've studied, but the class and the trauma of what it was, I was the only black in my class. I was only black. There was 2 blacks in our major. I was the only one in this particular class. And I remember having studied, and the exam was in front of me, and I couldn't move. I was paralyzed. I couldn't move. And I realized that, and everybody was just writing around furiously, and I knew the answer, but I couldn't move. I couldn't move. I didn't understand what it was at the time. Now I do because I'm a behavioral health, mental health professional, but back then I didn't. Afterwards, I went to the professor and I said, he said, I saw you up there. He said, were you did you not study for the material? I said, yes, sir, I studied. But I just couldn't move. I didn't realize the emotional trauma that was running through me of being baptized on this Ivy League campus because I didn't think I belonged, to your point. I didn't think I belonged. But my friends helped me. They helped me. They said, Forrest, you belong. You didn't get here other than you belong. And as a result of that, I was able to go to that professor and talk to him, and I subsequently passed that test and subsequently got my degree. So that was just one of the stories that I was in college at the time. But I got many more. So I just want to give it to, I don't know, did I use all my time?
You did, but I enjoyed
You know that.
Okay.
And that's moving. That's very passionate. And that's what we're about today, when somebody can be authentic. Thank you for being authentic.
You're welcome.
But I will never shut Mr. Coleman down. We will condense ourselves before we do not hear from you.
Well, thank you, but I will be brief. Well, there's really not very much that I have to say, because I think one of the things we think about, I think about when it comes down to learning is that, I'm going to quote Dr. James Comer. is that there's no significant learning without significant relationship. None. Mr. Forrest, as I call him, already invited everyone in to what I call, he invited you into the room. We're always in the room. Whether we have our backs to the walls or standing in the center, we're always in the room, and the children are always in the room. And they're always looking up to those who have been in the room first. And they don't ask us for what you know. They don't know that we know anything, except that we start with, they know that we're safe. Mm-hmm. They know that we're comfort. They know that we're a part of them, and they're a part of us. Social emotional learning is not about children. It is about the everyone else. It's about the adults. Children have never been adults. Adults have been children. So I think about that when I think about, Mr. Forrest. He's like, Norwood, I need this, and let's get this. How are we going to assess this? And I'm like, well, we're going to assess it by we're going to go have a conversation ultimately. That's what we're going to do. We're going to engage in the oldest thing that human beings have done since the beginning of humanity, is we're going to have a conversation. We're going to hold somebody in a space. We're going to hold the space. We're going to attune to what doctors and nurses do. We hold you in a space, even if it hurts. I think about the work that our lieutenant governor has done throughout most of her life, is holding somebody in a space, even when it hurts. I'm going to trust myself to trust you that you're going to hold this space. You're going to keep me safe when I don't know how to keep myself safe. That's what children come to school to do. They don't know what they're going to learn. Parents may tell them. Others may tell them. They come to learn what it is that they assume we want to share. I always think about, what is it that I want to share? Because if I'm not intentional about it, then it becomes the everything else. If the Life Health Center is about probably the same thing that everybody else is about. It's just we want to take care of kids. We know that folks have not always had an opportunity to be in a place of safety. And once they get to baseline, they haven't been in a place of privilege. And we fragment those in our head. But in actuality, a financial profile has never told anyone who feels rich inside that they are valued. Mm-hmm. So we understand that to what the district and really what we all are talking about is that, equity is about just being able to create the safest space for everybody. And we take our own little niche. We focus on health. Everybody deserves to be healthy. Everybody deserves to get to a doctor. Everyone deserves, when there is a trauma, which happens to everybody. Trauma is not a new thing. They did not invent bears when we were born that chase you, across the field. We all have a trauma response. It's natural and normal. But at the end of the day, we have folks that have been overexposed and underserved. Mm-hmm. And they're not who we think they are. Mm. Last year, we did, I can't remember, 900 assessments. Because we do a universal assessment of every child with trauma. It was like 950 something. Of these children, a portion of them I'm going to talk about, were all tier 1. doing really well. They looked really good. And by the way, these are kids that are ages 5 to 10, 5 to 11. Of those kids, 70% of them, 70%, just by us asking the question, not only had symptoms of trauma, 70% of these tier 1 kids in this group that I looked at were significant for trauma response. We were fortunate. And then, what do you do with them? We're at a school. Oh, well, thank goodness we have some healthcare providers in the school right here. We got a team of folks in the school. We got a little grant money to make sure that they're getting what they need and that it's not being provided to them in sort of, well, let me see if I can move this over here. We had what we needed because the children, they came to school and they just wanted to be safe. The teachers wanted to be safe. And we were able to sit down with the teachers and the teams and the folks. And we talk about integration. Integration is not medical health and mental health. Integration is a community coming together where everybody in the village is useful and nobody can be discarded. We work in a system, and we're grateful for that system, where educational health, mental health, and physical health are all a part of the integrations. And so we look forward to being able to continue to expand and grow in that way so that we can keep another kid safe. So, thanks.
Well, thank you. So you're helping lay the roadmap. That's what we're doing today, laying the roadmap. And speaking of laying the roadmap, I know another gentleman who could keep us for an hour entertained but mindful and relaxed. He was the Lieutenant Governor's Challenge Award winner last year, Mr. Kyrie Bay. And you have 10 minutes, 5, whatever you need, sir.
Excellent.
Right?
Excellent.
You're just cutting into Amy and Patrick's time, but that's, they love listening. They're enjoying this. Go ahead.
I will make it quick. First off, I want to thank you for inviting me to this event. I'd like to also thank my superintendent and several DOE staff who have, over the last couple years here, have assisted me in some of the things that I've done at McCullough Middle School and Colonial School District. My thing that I kind of got my claim to fame for is I created a MBSR for teens in middle school. That's a mindfulness-based stress relief course. That's kind of what the rock mats, if I had a little bit more time.
I was wondering if he was going to have to
I
walk
would
on rocks.
love to, but I don't want to cut into anyone's time here.
You can demonstrate.
But is what I would have my students do is a lot of them, they don't see themselves in the self-care or the mindfulness and yoga. It's just not in their wheelhouse. It's not something they see in their community. And I wanted to bring that to them. So before I actually really get into what my program is about, I want to share something with you. I was kind of hesitant to come here today. My youngest son, who is actually a student here at Colonial School District's William Penn, was diagnosed with type 1 diabetes 3 weeks ago yesterday. And if any of you know the challenges of that, I am very torn to be here today. So I'm sending my shout out to him and my wife, who are actually at the beach right now. I drove 2 hours to get here. Honestly cried because it was the first time I was able to be the one not being taken care of instead of taking care of them. With that being said, that really points to the mental health issues that are out there that our students, families, and staff face. Our kids come to school with an invisible backpack, and in that invisible backpack a lot of time is trauma. So do our parents, so does the community, and so do the staff that come in here every day to serve these children. With that being said, I would like us all to have a quick mindful moment. So, this is what I do at the beginning of every one of my classes, is if you could sit up straight, put your feet comfortably on the floor if you can. If not, cross them at the ankles, placing your hands comfortably in your lap. I'm going to teach you three things. One, you want to breathe through your nose if you can. Is what you do is you activate certain things that you don't activate is if you're breathing through your mouth. Your nose hairs and mucus and all that is like a humidifier and a filter. And also I teach my children to use the 3 planes of movement, which is left and right, forward and back, and then twist. I would be a little bit more elaborate with that, but today I'm going to have you do that kind of yourself. Just before we get started, Do that for a couple seconds here. Use those 3 planes of motion. And now kind of bring your head back to center. From here, I want you to abdominally breathe. So put your hands on your belly. And when you take a deep breath, I want you to push your belly out. And when you exhale, I want you to push your belly button into your spine, kind of leaving a space. We're going to do that 3 times. Inhale. Exhale. Inhale. Exhale. One last time with me. Inhale. Hold it. And sigh it out. Thank you for doing that quick mindful moment with me. If we could go to the next slide, I believe I have a, and if you could hit play on that for me. Now, as you can see, these are some of the highlights from my class for the last 3 years here. The actual class that came in when they were in 6th grade, this is them in 6th. They were the ones that graduated. They've been through so much. Our school was going through a change of a principal. Then all of a sudden, halfway through their 7th grade year, they were robbed of that at the beginning of the pandemic. And then they came back to what we call virtual and face-to-face. And these are some of the students that actually graduated from the middle school this year and now are going to be William Penn Colonials this year. As you can see, my students are not the typical yoga and mindfulness students that you usually see. And I wanted to make sure that they seen themselves, no matter what color, size, gender that they were, that they found a safe space that these 2 gentlemen were speaking of. And I'm really big on what it is to be an agent of change and also a positive serve and return agent. So whatever my kids needed, I became that. Many kids just don't call me Mr. Bay. They usually call me Krusty Dreads or Dad for whatever different reason that may be. But one of the things that I wanted to do was be there for them because I am them, just like we all are them.
Yes.
So when you see these students, it's not those kids. Those are my kids.
Yes.
Just like your children, if they were in my care, would be my kids.
Right.
So I'm their coach. I've coached softball, field hockey, and wrestling. I'm a horrible field hockey coach and a horrible softball coach. But I kept a lot of those little girls off the streets and had a place to go, and they knew that somebody was there for them. I also do the Black History Month, Latinx Heritage Month, and also the talent show. And I bring my own African art in and let the kids see some of the great accomplishments that they can become. One of the greatest things that I wanted to do was also when you go into my classroom, and I'm giving an invite to anyone after this, if you would follow me to McCullough Middle School, I have also, and which is down the street, we have a state-of-the-art planetarium that at the end of every one of the semesters here, I bring them in there. We use several of the apps to teach them how the central nervous system is controlled by their well-being, their emotions and all. And then we do a body scan underneath the stars on the yoga mats. As you can see, the kids are using my rock mats. A lot of our students don't get a chance to go out into nature that much. So I wanted them to be able to take their shoes off. And a lot of them would be like, no. Plus, I was trying to trick them into taking their shoes off in a couple weeks after so that they could actually do yoga in the back of my classroom there. One last thing before this ends is I kind of teach my students to be mindful ninjas. I came up with mindful ninja because they like to use another word, and I wanted them to be ninjas and mindful. So as what I do is being a mindful ninja, you use several tools. The one tool is a staff, and that staff stands for stop, take a breath, analyze the situation, focus on a positive future with you in it. But one of the things that they focus on is also a shield. That shield is for them to protect themselves from whatever situation they're going through. And on that shield has 4 different spots. The first spot is breathing. Because if you can control your breathing, you can control the adrenaline and cortisol that's running through your body when you're triggered. The next part is for you to check into your emotions. Once you check into your emotions, you focus back on breathing. Then you check on into your thoughts. What are your thoughts at this moment? Once you bring that into your wheelhouse, you go back to breathing again. And lastly, they check in with their body sensations, because all of those in that shield go into what causes you to react or respond. And I want them to respond and not just react. Because when you respond, you're using your cognitive upstairs brain. When you react, you're using your emotions and your instinctive brain. And we know your emotions and instincts sometimes get you into trouble. So you want to get them that opportunity to break up some of that cortisol and adrenaline and get back into that upstairs brain. Because many of my kids, if you step on their shoes or bump them, they might want to give you them hands. And I want to make sure that they don't give each other them hands. And with the results from that, could you go to my next slide? We can skip that. One more. Just some more things, because mindfulness isn't just inside my classroom, it's outside my classroom. And how could I teach my students not to flip their lid and then go into another classroom and have a teacher flip their lid? So my next thought was through the coaching of Terry Lawler over there and several others who were like, you can't just teach the students, you also have to teach the teachers. So from there, I started offering the same type of services to teachers after school, and also now train all first and second year staff in Colonial in how to incorporate mindfulness and some of these coping skills into their programs. I think I might have one more slide, or is that it? And again, this was the different techniques that the kids were taught. And like I said, I have many students that come back and say, your little stupid breathing techniques work, Mr. Bay. It helps me sleep at night. It kept me from doing this. Or my mother came home and she was jumping on me and my brother about something. I was like, Mom, you need to take some breaths here and calm yourself down, like Mr. Bay said. So from there, so again, I appreciate everyone's time. I'm going to end it there. And thank you. And one more time, make this the deepest breath that you've taken today with me. Inhale. And sigh it out once more. Thank you all for participating in that mindful moment with me.
Thank you.
Yeah,
Well,
thank you.
And thank you for being here with Invest to Your Son. You know, we've got the perfect kids camp in mind. I already do for him. Yep, for newly diagnosed diabetic children. Okay, with that, I'm going to turn this to Christine Altos with the Department of Education Partners. Keeping on our schedule, we're a little bit behind, but that's okay because this is good stuff. And I know Amy and Patrick said they wanted to listen first, so we're having you listen. Go ahead. Yeah.
So thank you everyone who shared thus far. So proud to hear of all that's going on in our schools. And having been a former building principal, the relationships that are built and the family that you develop within the school is what helps to make us all successful. So thank you for all you're doing and for representing all of our schools across Delaware. So with that being said, now at the State Department, our job is to make sure that we provide as much support as possible to allow that to continue to happen with all that's on your plates and all that you're doing. So today, I am honored to be here with our Associate Secretary, Michael Rodriguez, and his team member, Susan Havistro, and also from the Office of Equity and Innovation, Terry Lawler. So I am going to jump right to Susan and Terry to share about the different supports that the department's been working on to help in all the great things happening in our schools.
Thank you. As Christine mentioned, I'm Susan Havistro, and I'm the Director of School Support Services at the Department of Education. I'm really excited to be here today to talk about the work that the Department of Ed is doing around the social, emotional, and behavioral health of our students and our staff. I will be providing some background information, and then Dr. Terry Lawler will be talking more about our plan. The focus of social, emotional, and behavioral well-being is not new, but what is new is this unique opportunity to expand and enhance this work. As was mentioned by Dr. Cooper, sorry, I have to look at my glasses, Mr. Watson, Mr. Coleman, and Mr. Bay, is that our students' social, emotional, and physical health must be strong in order to access educational opportunities. We at the department, we call that being present and ready to learn. So it's more than just showing up. You have to be mentally ready too. The elementary and secondary education, oh, please go to the next slide. The elementary and secondary education emergency relief funds under the Coronavirus Response and Relief Supplemental Appropriations Act, which we refer to ESSER 2, provides the opportunity to support our districts and schools in establishing or enhancing systems that address social, emotional, and behavioral needs of their students. As a team at DOE, we were charged with the development of a plan to do just this. The result is the Delaware Strategy for Social, Emotional, and Behavioral Health. We knew this plan required collaboration across the department, but also with our partners. These partners include several entities that are represented here today or in the audience. Both the Department of Services for Children, Youth, and Their Families, DSCYF, or KIDS, and the Department for Health and Social Services are critical partners in the physical, social, emotional, and behavioral well-being of our students. For instance, DSCYF is a partner in a federal SAMHSA grant, Project Aware. Our host today, Colonial School District, and is a participating district in the grant. And also we have members from the Capital School District and also from Indian River, and actually our lead from DSCYF here in the audience. Other partners include the Delaware Positive Behavioral Supports Project with the University of Delaware Center for Disability Studies team acting as our technical advisor. Project Thrive provides additional resources. But we also know the other partners critical for success are those in the field. Our administrators, school staff, school counselors, school psychologists, school social workers, nonprofits, mental health community, and the students themselves are important in the success. This plan was built on the logic that social, emotional, and behavioral practices are integral to learning, and multi-tiered systems of support are needed to support the implementation of these practices. We also know that our districts and schools are in different places in the implementation of their multi-tiered systems of support. And the plan is built that there be multiple entry points. This plan includes many of the guidance documents and tools that can support the development and enhancement of these systems. And Terry will be talking more about that. As mentioned, we know that the plan needed to have multiple entry points, but it needed to be based on the readiness, priorities, and previous initiatives and commitments of the districts, charter schools, and schools within the districts. Plus, we also know there's a variation as to the awareness of what supports and services exist. Implementation science is the backbone of our plan, and these include the stages of exploration, installation, and implementation. At this point, I will turn this presentation over to Dr. Terry Lawler, who would please go to the next slide. Thank you.
Thank you. The SCBW plan assures that every student gets what they need in Delaware schools. Access to educational resources and rigor at the right moment and right time. Every child, regardless of where they come from, what they look like, who their parents are, what their temperament is, or what they show up knowing or not knowing. Our goal is to cultivate a culture of care where every child gets what they need every day to develop the knowledge and skills to be ready for college and career success. Capacity building is designed to enhance systems, data, and practices to create physical, emotional, and psychological safety, leveraging our multi-tiered systems of support for academics and behavior. Universal strategies at the exploration stage facilitate connection and belonging to reduce the non-academic barriers to learning. The Department of Ed has also seized the opportunity to deepen our collaborations beyond our school communities to wrap supports around youth in hopes of building community resilience. Professional development has been extended to out-of-school time partners and community-based organizations, as well as parents and caregivers. We collaborate big with other state agencies and organizations like DSAM to host our Whole Child Community of Practice. We host annual Train the Trainers for our educators in partnership with Delaware State Education Association. In addition, we host quarterly trainings for trainers in community-based organizations with the kids department. We also collaborate with kids, the state police, local law enforcement organizations, and our school resource and safety professionals to pilot the implementation of Take Care Delaware. We are destigmatizing help-seeking behavior by promoting self-care, well-being, and mental health literacy for all through our ongoing commitment to youth mental health first aid. Moreover, we promote social and emotional competence as a protective factor that mitigates life's challenges. Installation and implementation practices deepen as we collaborate with school teams to integrate targeted supports with the assistance of school-based behavioral health professionals in collaboration with community mental health professionals. Our 3 Project Delaware districts with funding support from SAMHSA lead the way by piloting strategies for screening and assessment as well as behavioral health interventions at Tier 2 that promote prototypes that we can use across the state. At Tier 3, we offer intense individualized supports for students through Project Thrive, Delaware's Trauma Recovery Demonstration Grant from the U.S. Department of Education, to expand trauma-specific interventions. We're committed to assuring that children and youth don't merely survive life's challenges, but go on to achieve post-traumatic growth and live lives where they can thrive. And we do that by providing professional learning and opportunities to build relationships where we are informing the mind while engaging the heart and moving the hands to compassionate action.
Thank you for that. And I know they're excited in a moment to think about the funding and rescue acts and the ideas that we have. And to those who've come in late, we have seats. You're welcome to sit up front. And I know some of our legislators have busy schedules. They can swap out seats at this time. We thank them. And Secretary Manning, we've saved you to the end right before the Kennedys. Secretary Josette Manning, who does our Department of Services to Youth and Families. If you would like to chime in, you too could go on. And again, thank you to our Department of Education. Did I miss anybody? Mr. Rodriguez, were you speaking? Nope? Okay. All right, good. Okay.
Thank you very much, Lieutenant Governor.
Okay.
My division provides juvenile justice, child welfare, as well as behavioral health services for children in Delaware. And those services, particularly in our division of prevention and behavioral health, are available for prevention services available to all Delaware youth. Our intervention and treatment services are available to youth who are uninsured, underinsured, or are enrolled in Medicaid. I want to touch briefly on some of the services that we provide in addition to some of the things that were talked about here, and I will be quick. If we could go to the next slide. And you can go to the next slide. Thank you. In reaching our youth and families in early care and education settings, one of our programs is the Facet Program, and that stands for Families and Centers Empowered Together. And that is a service that we provide in centers, 3 centers in our high-risk communities, and the goal is really to empower our families and caregivers in order to keep those children safe and healthy and give the families the tools that they need to be successful. Additionally, we have our Early Childhood Mental Health Consultation Program, and that program is provided to early child care centers upon request when there is a behavioral issue identified with a youth. And we then provide supportive services to the center staff to help support the child and to give the caregivers the tools that they need so the youth can stay in the center. And we have been extremely successful with this program and have decreased suspensions from these programs significantly. Additionally, we have our behavioral health consultant program. We have 30 of those in our middle school. I think that's been touched on briefly. They provide clinical and consultation services and, again, help support staff and faculty and direct services and referrals for our youth. In our K-5 early intervention, our K-5 early intervention program provides services in our elementary schools. We have 54 family crisis therapists, and they work more with the whole family versus just the youth or just the faculty and staff to make sure some of those unmet underlying needs are met for the family. And, suicide prevention. We provide the Signs of Suicide Prevention program. We do that in the community. We also have Train the Trainer so that those services can be delivered in other areas. This is geared towards middle school and high school youth. And the goal is to raise awareness about depression and encourage help seeking and encourage partners and caregivers to grow in their knowledge of suicide prevention. We have the Mobile Response and Stabilization Service, and that is our 24/7 crisis response where the families define the crisis, we meet them where they are. That is an immediate response and in person in the home as needed. In addition to that, we do have the Delaware Suicide Prevention text line, which is available to our youth who don't want to pick up the phone, perhaps, but are more comfortable with texting. Next slide, please. And these are our trauma-informed approaches in our schools and communities. Terry already talked about our Take Care Delaware pilot, which we are very excited about and are hoping to roll out across Delaware in the fall. And she also spoke about the community-based trauma trainings that we collaborate on. Other thing that I wanted to mention is our Youth Response Unit. This is an initiative that we partner with the Wilmington Police Department and to have an immediate response after a trauma, and that's usually a violent crime. And so this team will respond and they will provide short-term clinical services and the necessary referrals and assessments. Next slide, please. And when we are in the area of building capacity, so we recognize that the number of child psychiatrists available in Delaware is not near enough. So we began the Delaware Child Psychiatry Access Program, and we started in 2019, so supported by an HRSA grant to connect pediatric primary care professionals with a free child psychiatry consultation. And the goal is twofold. It's to help pediatricians be able to respond more efficiently and effectively to their patients' needs, but also recognizing the shortage of child psychiatrists and the waits that could happen if there was a need. So by marrying those two things, we've been able to get youth what they need quicker and sooner and at the proper level with the input of a child psychiatrist. As of July 8th, we had 214 pediatric professionals enrolled in the program, which exceeded our program goal of having 200 enrolled over 5 years. So we well exceeded that, which is really exciting. And I think that's as quick as I could go. I think that's pretty much everything. Thank you.
That's a lot. There's a lot here, and as I look out in the audience, I know that I challenge us with the roadmap ahead. Certainly don't think we won't get everything done today, but this is the start of a continued work and conversation. And to our partners, to those who aren't at the table on this side, but on that side, you are equally involved with us. I want to make that clear to my doctor friends, folks at the BHC, the teachers, DSEA, all of you are involved. So as we begin to continue to build on this, I know our goal is to maximize Rescue Act funds, or whatever we can do. And so I'm going to turn this over now to Patrick and Amy to give us some of their thoughts, what they were hoping for, expectations, and again, you can talk as little as much as you want. We have the rooms technically till 3:30, but I don't think we're going to get kicked out of here, right? If we're a few minutes late, it's a lot cooler. It's cooler in this room than out. And I do know a couple of our legislators, if they want to speak at the end, we'd love to have you do so. But since we're live streaming, you will have to come join us at the table when that time comes. So just so you know. All right, to our incredible guest, Amy Kennedy.
Thank you so much. Hearing all that you presented just for me is really inspiring. It's exciting to hear about what's happening, but it also really speaks to the challenge that's in front of all of us. I started as a middle school teacher and now as a mom with 5 kids, one in middle school who I wish had Mr. Bay as a teacher. I think that's what we want for our kids. So the challenge is, how do we make sure that every child gets that experience, that every child has that relationship when they come in that you spoke about, Forrest, because that's so important that our kids are getting that, and not just because they're lucky enough to be in Colonial School District, but that we're able to replicate that throughout, and that we're doing that because we're setting up those systems in our schools and throughout the state and throughout the country. And so what we'd like to see happen is that we're going to make those decisions, not just through the grant dollars, which we're all glad to have, but through sustainable funding that we know can be there to support these practices. And you know, one of the things we're doing, I'm on the board of Mental Health America. So one of the things we're doing at the end of July is to issue a state report about state by state what's happening across the country, so we can see what these best practices are, so we can take a look at where each state falls. I'm excited to see all that's happening here in Delaware, because I know you will be high on the list with, you know, the multi-tiered systems of support. We're looking to see that in every state. We want to know that the students who are here, former students who are here, are part of this conversation, that they can speak to how easy or difficult it has been to access care, because we want to hear from them and we want to know what they need, because it really is all about the power of we, empowering the students, that help seeking skill that they need. And so what I heard today was that, you know, you're offering those screenings. I think that's so important. That's one of the things we're looking for. And how do we make that school the site where all of this can happen? Because you're touching all of our students, our future leaders, and you're able to bring in the families that are going to be a crucial piece of this. So we've pushed from Kennedy Forum, the Department of Education, not just in Delaware, but the Department of Education under the Biden administration, to issue that guidance, because we know the rescue plan says that there's $130 billion that can be used for mental health, but we need to hear how specifically it will be used, and how, if that's only going to last 2 or 3 years, how do we make sure it's there beyond that? Because we know that this, while it's been more difficult since COVID, is not new to COVID. Those students that you talked about, that invisible backpack, I mean, that imagery is terrific, because, you know, it's so clearly students are coming in. When I was in the classroom, I didn't know where to turn. When I had a student that I knew was struggling, I could see it, whether it was in behavior or in the grades, and I didn't have a place to turn. We didn't have the resources in the school. I didn't know how to speak to their parents about something that I was troubled with. And this is something that burdens the teachers as well. It leads to burnout. When you feel like you just can't make the kind of difference that you really need. I taught history, and I thought, that's not what my students are going to take away, I hope, from this class. I hope I'm giving them some life skills to deal with all the things they're coming in with. Because if you can do that, then it doesn't matter what else you put in front of them. It can be science, it can be math. They're going to be able to do well because they're okay. And when they're not, it doesn't matter how engaging your lesson is going to be, it will not make a difference. And so embedding all of this into the curriculum is key. So how do we make that science lesson that you're talking about, where we're talking about cortisol, part of the biology class, so that kids understand about their own well-being? How do we make that SEL something that translates not just at school, but they can go home and they can teach their parents all of those same skills? They're able to better interact with their families. And you're doing it, you're laying the groundwork here to have culturally competent care, to make sure that the staff is well trained to make those partnerships happen. And I think the goal that we have as advocates is to push to make sure that the policies are going to be there to support you, that the funding is going to be there to support you, and that this is a critical moment where we can reimagine education. I feel like this is the, that you're here in July, right? It says that we are all very concerned, but also that this is the time to lay that groundwork for this school year, because teachers are all thinking about what September might be like. So thank you all for being here today, and I know Patrick has some thoughts too.
What can I do to add to that? You know? All I can say is come Thursday, my wife and I will be celebrating 10 years of marriage, and you can understand why I'm the lucky guy. And I want to thank the Lieutenant Governor for inviting all of us, and what an all-star, you know, not someone who boasts, but someone who gets it done.
Thank you.
Someone who really has that personal connection, which I also come from a small state. I represented Rhode Island for 22 years in public office, and we also knew everybody. And in fact, in my state, you could spot who people were by when they were driving the opposite side of the street by their license plates, because that's how well we knew each other. You really have a gift here in Delaware in being able to work with one another and break down these silos. But how important it is to set the example, as Amy was saying, for other states around the country. Because as we all know, as state legislators, where I started my political life, you know, we don't like to take risks often as politicians. We prefer if someone else has, you know, trod that ground and mapped it out for us. So it's easier for us to say, let's go with plan A, because that plan A has been tested and tried and true. And so I love what the Lieutenant Governor is doing to kind of put together how you guys are real leaders in this space. Because I can guarantee you that what's happening here at Colonial is not happening in a majority of schools and school districts around this country. And, you know, we started the Kennedy Forum on the anniversary of President Kennedy's signing the Community Mental Health Act of 1963, which is the last bill he signed before he was killed. And he said in that signing ceremony, he said, people with mental illness and addiction need no longer be alien to our affections. And then he said something really powerful, that is why I'm mentioning it today, or beyond the help of our communities. So he wasn't saying beyond the help of our psychiatric hospitals, although we need those, or our medicines, and we definitely need to improve our medicines, or anything else. He said communities, because just like this panel, Lieutenant Governor, it's going to take everybody. And we don't always know how to do that in government. You know, we like to silo budgets. You know, we like to silo disciplines. We don't always work well together. But in order to reach kids, that's going to be what we need to do. And I love the idea of, you know, the relationship. And how important that relationship is if you want to deliver. So I just want to thank you, Lieutenant Governor, and just say, you know, we started this forum because when I was leaving Congress, even though I had authored the Mental Health Parity and Addiction Equity Act, which was kind of an offshoot of my uncle's Community Mental Health Act, you know, I found as a legislator who should have known really what all the issues were, that I never got lobbied, if you will. I never got presented, you know, what the issues were. Like if I were someone who supported labor, believe me, AFL-CIO would have mapped out for me. The Chamber of Commerce would have delineated for me every issue in every committee and what I could have done to help it. The League of Conservation Voters, air, water, land, all mapped out by every single committee and subcommittee in Congress. Mental health? No. Addiction? No. No sense on members who were on the Housing Committee that perhaps that's one of the most important committees because stable housing is so crucial to a family's security. What about the Education Committee? I guarantee 90% of my colleagues do not appreciate this whole discussion, how significant social emotional learning is to learning, and that you can't have numeracy and literacy if you don't first have kids who are able to absorb that information, because to our colleagues' points, their amygdalas are on fire and their prefrontal cortex are shut down and they're not able to absorb that information. We have the science today that says if you're not doing, you know, social emotional learning, you're missing one of the most fundamental aspects of learning and of education. And we have an opportunity post-COVID with back to school and this new tranche of dollars, $130 billion, to really, like Amy said, jumpstart a new paradigm for education. And what you're doing here in Delaware can actually be marketed to other states around the country. It's going to be very helpful when Amy is putting this report card together, so that all the states know, well, geez, they're doing that in Delaware. They're doing it in this state, they're doing it in that state. Oh, that might have some relevance. What did they learn? Is this effective? You guys are out there, blazing the trail. So I just want to say thank you so much for the work you're doing. It is so crucial to our future. And, President Gay is known for a lot of things, but one of the things he's not well known for is that he started the Green Berets. And, I went down to rededicate the John F. Kennedy Special Warfare Center in Fort Bragg. And the general said to me, Congressman, we have more mental health for our special forces than any other branch of the service. And we saw our young ROTC candidates as we were coming up the stairs. And I said, General, I know I care about mental health, but the Green Berets, they don't need mental health. They jump out of airplanes and they land in the water. They swim underwater for 5 miles without breathing. And they hit the beach. They're speaking 6 languages. And they're at home reading to their kids by dinner time. I mean, they don't need mental health. And he said, no, you don't understand. He said, we look at mental health as a force multiplier. And our military has figured it out. Now it's time for our country to figure out what our military's figured out, that the team is not safe unless everyone is safe. And we all need to be part of this. And this is the new frontier in mental health, is preventing mental illness and addiction, which is unfortunately, eating us alive as a nation. And as Frederick Douglass said, it's easier to build strong children than to fix broken men. And the African proverb, instead of trying to fish everyone out from down in the stream, why don't we keep more of them from falling in? And that's our job, is to get in early and give those kids the backpack and the tools to present. Whenever they feel stress, they know how to manage that stress. And so I will say finally, the Lieutenant Governor took our parity laws, you may know, on the federal level that says mental health needs to be treated the same as the rest of the medical system. And she brought it here to Delaware. And you should know that the reason for that is because if families don't have that comprehensive protection from their insurance plans, their kids won't get it. Because a lot of health plans do not treat family coverage with mental health as integral to family health. She's already been successful, thanks to that, to protecting a lot of families here in Delaware because there's more accountability now in the insurance commissioner's office because she brought that here to Delaware. So she's a person of action. That's why when she said, "Can you come down?" I said, "Absolutely." Of course, we're not far away. We're in New Jersey now, but I'm sure some of you saw some of the ads from Amy's campaign.
A year ago this week, you were probably a little tired when you were primary. Yeah.
But I just admire how my wife put herself out there to run for office. It's not a romantic thing to be in public life, in case you haven't figured it out these days. It's not. But I tell you, the Lieutenant Governor reminds us about why it's so important that good people serve the public in office and take a lot of flack for a lot of things and often don't see the good things that they do. But I think we're witness to it, and we know it because it's a small state like Rhode Island, right, that you're a real champion. And when you automatically wanted to go to Mr. Bay and help him with his child, it was a sign of the compassion that you have, Governor, just automatically in it to win it for somebody else. That's a beautiful thing.
Well, we appreciate it. There's a lot we could do. We are conscious of the time, conscientious. I know that we're going to have some offshoot conversations to Christine and her team and others, and to the respective community agencies, partnerships. We have incredible, oh my gosh, hospital partners I'm looking out here that we have a job to do. We want to rank high, but we also want our state to be the model. And I think with the Rescue Act funds, with our legislators who are here, those who are streaming in who couldn't be here, we will be able to continue to roadmap forward. I do know we have a couple of the legislators that wanted to jump over to the table. We'll squeeze you up here for comments. Senator Rapport, did you want to jump on over? We'll squeeze you in between our favorite folks over there. They're making you go. I was going to put you over here between mindfulness, but thank you for that. Is this what you want? Is this what you wanted? Okay. So Senator Poore and Representative Melissa Minor Brown, who are here, and it seems as if Representative Johnson and Senator McBride are remaining quiet, I guess. No questions or comments?
Not remaining quiet.
Okay, all right, they're going to go behind. Okay, they'll go behind. Go ahead.
And to Mr. and Mrs. Kennedy, let me just say, there are a couple comments made, and I don't know if you watched, we all kind of made some eye contact. This group is definitely not afraid. So we are not afraid of tackling tough issues.
Senator Sokola.
Yes, I think that there were, Senator Sokola, please, our President Pro Tem.
Yeah. Longest serving education chair, too, I think,
yes,
in a legislature.
in the United States, yes. So we have tackled many tough issues in the state of Delaware, and similar to Rhode Island, you're right, but we have a little motto here. It's made it, dated, or related to it. And
sometimes all.
And so we're not really worried about how many degrees you have or where you've gotten them from. We actually want to know where you went to high school. We also want to know, because we know somewhere along the lines our families have connected in one way or another. We've either played kickball with a cousin, or we've played softball at the Little League, or maybe we've wrestled. In case any of you are confused, I do love wrestling. So there, always have to get the wrestling in there. So
for your son,
for my son, exactly. So
please clarify.
So when we talk, when we talk about the, body, mind, and soul, I am personally a huge advocate for making sure that it's not just academics. We do need to complement it with safe space. We do need to let our children know that they are always and forever safe. And the way we build great men and women is by starting in the beginning and not allowing ourselves to fail. But at the same time, it's also rising up the teachers that spend the most time with our children. You spend more time with our children every single day than we get to. And so we entrust you with our children. And so we're super thankful. Let me make sure, as a mother of three, that I thank each and every single one of the teachers that are here today, but more importantly throughout the district, because you do an amazing job. And some days I know you probably are asking yourselves how you can come back that next day, but darn if you don't. And darn if you don't give 100% every single day. So we are very thankful to that. It's very exciting to hear you talk about your scorecard. It's very exciting to hear you talk about funding. Healthcare is a business. Let's be very frank about it, and let's not sugarcoat it. There is a lot of money that flow through our healthcare systems, and so we cannot be neglectful when we are talking about mental health, and it has to be in the forefront. And the pandemic was an excuse for us now to have this conversation. This has always been a part of our lives. It's about whether or not we would address it. It's about whether or not we kept it hidden in a corner of our home, in a corner of a school, or maybe we just didn't address it at all. And so today we now have that opportunity. You coming to the state of Delaware allows us to highlight it even more. Lieutenant Governor, thank you again for all of your efforts and how hard you push each and every one of us, but also that you recognized this several years ago that we needed to move forward with this. And so I don't want to speak on behalf of my colleagues,
but you might be. They're looking like
exactly.
Some might. And speak, yeah.
But we certainly stand strong with you in promoting this. Unfortunately, the one piece of legislation we are all sponsors of the legislation, but the prime sponsors are not here. Senator Pinckney had to leave, but also Representative Longhurst. They carried the weight of House Bill 100. Christian Dwyer, I know you're somewhere in here. Yep, DSEA. After we left session, I went through all of your videos that you put together, and there are a couple that certainly caught me deep down in my soul for the conversation that your teachers were having in regards to mental health and our students. And it told a story about things that we don't know. And so thank you very much for doing that. But House Bill 100 is saying that over the next few years, we will be putting mental health professionals in the school systems in the elementary grades. And we're not going to stop there. Representative Longhurst has given her support, her dedication, and her determination to make sure that we will continue down that path, not just for elementary, but for middle school as well as high school. And I'm glad to say that the bond committee has also made sure that we have put some money towards making sure that we open and support another wellness center in Colonial School District. So we do collectively have a good path forward. Your support, your funding, certainly will help us continue to drive that. So at this time, I'm going to...
Representative Minor Brown, also a fellow nurse. Yes.
Yes, thank you to my fellow nurse for convening this group. This is really amazing. I actually walked in on the tail end because I was with my nursing students, and we were just having a conversation about a holistic assessment from the beginning. But as anyone here who knows me knows, this is a topic that warms my heart. And so as a nurse, I have worked in every prison in this state as a nurse educator. And when you have conversations with individuals who are incarcerated, you begin to peel back those layers, and it brings you right back to this conversation that's being had right here. Early intervention, prevention, whether it's a mental health diagnosis, and there are so many individuals who are environmentally disabled that still need that support. And I can share a personal story. I'm a mother of a 7-year-old, and I have taken guardianship of my niece. I actually had two and a 3-year-old at the same time. I didn't request that, but she was in a situation where she was being neglected and abused, and I had to get my niece. So we're here in Colonial, and we are fortunate enough to be able to utilize the wellness centers in the elementary schools. Thank you so much, because it has helped us tremendously. The intervention that's being provided to my niece is so intense. I'm just so grateful. Thank you so much. And to my son, he was bullied in kindergarten. You know, he needed to learn coping skills. He needed to be able to advocate for himself. And that's what the wellness centers do for my son. So thank you for that. I also just want to say, with the elementary wellness centers, I love that you meet with every child, not just the kids who are exhibiting high-risk behaviors, because looking at the data now, we're seeing that the children who did not exhibit those behaviors have actually had the most issues at home, and we would not have known that. And I walked into the wellness center one day, and I'm looking at these kids, and they're playing with these jars, and there's rocks, and there's glitter, and I'm like, what are they doing? And the social worker comes out, and she said, we're working on coping skills. And I just thought that was so amazing. So early intervention, prevention is key. Forrest Watson, everybody at this table, thank you for the work that you're doing. I just personally have been able to utilize the elementary wellness centers through Colonial Elementary Schools, and I hope that we can see an elementary wellness center in every elementary school, because our kids need that so bad. So thank you so much. I'm so happy to be a part of this conversation.
And we have a few more minutes, because they graciously gave up a lot of time that they want to hear, so we'll a little bit more.
Sure, I'll certainly I'll be
Senator
brief as
McBride.
well. I know asking elected officials to be brief is always
well, you're new,
so
maybe you follow the rules.
Still, I've not fallen into the bad habits yet. Tour guide, right? It's an inside joke now that we all have. Well, first off, Lieutenant Governor, thank you so much for convening this. I took over as chair of the Senate Health Committee when I took office in January, and as I'm introducing and working on legislation, one of the things I always try to do is look to the leaders who built the progress before me, and your name when you were in the Senate is on pretty much every issue that I've been working on, and the progress that we've been able to build on is a byproduct of your work. So I'm so grateful, and I'm so grateful to have both Congressman and Mrs. Kennedy here, and I'm grateful for your advocacy. You know, one of the things that I think is so clear is that when we're talking about supporting and empowering the whole child, we have to have a whole community approach, and I think that's what this conversation represents. We've got stakeholders from every single different avenue of society coming together to do this work. And as I was listening to everyone present, I think the word that just kept coming to my mind is on the banners in front of us, which is innovation, that everyone at this table recognizes that this crisis, that this moment requires innovation. I think one of the silver linings of the last year and a half is that crisis breeds innovation, that COVID has required us to reimagine so much. And one of the lessons I hope our broader community, our broader world has taken from this crisis is that our health is central to every other aspect of society. You can't have a thriving economy without taking care of public health. You can't have strong schools and academic success if students aren't healthy, both physically, mentally, and emotionally. And Congressman, I really, really appreciated your remarks, and to build off of what Senator Poore said, how critical early intervention is. That there is no point that is too early. Indeed, if we aren't starting at birth, we are already behind. And that's why we voted unanimously in the legislature to pass HB 100 to fund mental health services within our elementary schools. But it's also why we're all looking even before kindergarten to making sure that we are supporting children birth through 5. Colonial has been exceptional, innovative when it comes to early childhood education. And we need to make sure that no matter the district you're in, no matter the family you're born into, no matter the zip code you live in, that you have access to early childhood education, universal pre-K, and affordable childcare. It's one of the reasons why I've been championing paid family and medical leave in the legislature, because we know so much of the emotional health of young people happens in those first few weeks after birth. And so I think this conversation is so critical because we need that whole community approach, and we need those systems and structure changes in order to truly address the root causes of these problems, so that we aren't, as the Congressman mentioned, trying to fish people out downstream. So thank you all very much for this conversation. I'm excited for the work ahead.
It's awesome. And I do want to mention to our Capitol colleagues and my alumni as an IR graduate in Indian River, we do have the others here who have been working in this lane as well today. So shout out to you as well. And I will be very mindful of time, but I would love to see if Representative Johnson would like to say anything, or in Senator Sequoia.
I was taking some notes during this entire event, so thank you very much for putting this together. And before I go into my few words, I wanted to say, Forrest, thank you, because exactly what you shared about the anxiety of being in this space, I don't know if you all noticed, I came in late, I had my mask on, and I sat down, I still had my mask on, and I'm looking around and I'm like, they don't have masks.
You can still wear it for public health nurse speaking here. I have no problem with people still keeping their mask on.
I know that I broke out in a sweat afterwards, but you know, I did this self-talk, and I walked myself through it because we can, right? And that's okay. We're all human. We experience those type of things. So what I wanted to say is this, and I heard this at a DOE ACE seminar maybe 2 years ago, and it still lives with me, and it's this: hurt people hurt people. And that just struck me, and it's been literally 2 years since you guys had that event, right? And I still think about that. And I wanted to just say, you know, that trauma isn't a life sentence when it is recognized and when people are treated. And now having a division of health and wellness, as well as the Life Health Center, as well as Mr. Bay, like, this gives me so much hope. Because we can't very well think about educating a child if we are not holistically addressing all of the different pieces that make up that child, including that child's family and community. So that, I'm just thrilled beyond belief. Like, finally, I don't feel like the wild Zen person in the middle of the room saying, let's do some deep breathing, people, right? I'm like, yes, I'm not by myself.
We're going to channel that. She's the chair of the Black Legislative Caucus too, so we are going to channel that. And we'll end with I always say the senior senator. I got to tease him when I was the junior senator. Senior Senator Sokola, do you want to say anything? I know you chaired education
going
for
after
the longest.
these four is pretty tough. and I just really, I'm always happy to be in any group where Forrest is talking, because I just think he always hits something right out of the park. And the way you started with relationships and their role in healing, and then Mr. Coleman and Mr. Bay talked about relationships and learning. And I could see a thought bubble going over Senator Poor's head about how important relationships are to legislating, but I don't know if everybody else saw that.
He got it.
But this is really important, and it's important to have as many stakeholders engaged, and I think that's a tribute to you, Lieutenant Governor Holong, because you do reach out to everybody all the time, and if there's a way to get it done, we will get it done. And I'm particularly thrilled that Senator McBride talked about Senate Bill 1, because that, I think, is I was thinking this whole time how that can help what we're talking about here. So thank you so much. You guys are always welcome to Delaware. There is no toll to go back to New Jersey.
There is no toll.
Please,
it's a good idea. We need the money.
That's right. We thank you all. I don't know, the press was taking notes. I know a couple folks are here, and I recognize I have a couple busy doctors. If you all have to get up and go. Does the press have any questions, or did your questions get answered? Some were in and out. Anyone? Or maybe they're going to catch you guys individually as you run out the door, maybe. That's probably what they're going to do. Anybody? Okay, well, I just want to recognize also DTI, who came up and supported our team, who live streamed this for us, and the governor's office that was extremely supportive of our actions today. And we just thank you all. Hopefully you'll take them up on the offer to see the Wellness Center. I don't know how many are going to drive down the road in the heat to see you today, but they might just do that. And so again, I want to thank Christine and everyone at DOE, Keith and my team, and the Lieutenant Governor's office. I just want to thank them for their support. And we're going to be around a few moments. As you can imagine, we have a tight schedule. Some of us have to go a little bit up the road in a little bit, but we thank you all so much. We're not done though today. This is the start of the conversation. I hope that Amy and Patrick will use Delaware, that will strategize that right down the road, President Biden's residence, and that we're going to make him proud of how we spend the funds here in Delaware. So thank you all for coming today. Thank you.